Hi, I am Dr. Sandeep Dachuri, consultant ENT head and neck surgeon at KIMS Sunshine Hospital, Begumpet. Today we are going to talk about commonly used devices known as hearing aids. These hearing aids are the most commonly used devices for hearing loss, and they are usually recommended by an ENT. The ENT surgeon will usually check your ear canal, and if the canal is clean and the eardrum is intact, then they send the patient to the audiologist. These audiologists usually do the hearing assessment and then recommend about the hearing aids. So these hearing aids help in increased communication and increased quality of life of a person. Hearing aids can be used both by children who have hearing loss and by adults who have hearing loss due to old age, which is called as presbycusis. Hearing aid usage is very important. If the patient is motivated and he is willing for usage of hearing aid, they use the hearing aid without any hassles. Whereas if the patient is 80-year-old brought by the kids and the kids are forcing the parent to use the hearing aid, these are the patients who does not want to use hearing aid and they will not be satisfied in using the hearing aid. What are the components of a hearing aid? The components of hearing aid are like building blocks. Imagine building blocks like that. So it contains a microphone, it contains a battery, it contains an amplifier, and it contains a receiver, or they are miniature loudspeakers. So the microphone will take the sound energy, it will collect the sound and it will convert the sound energy into electrical energy. The amplifier will amplify this electrical energy and the receiver or the speaker will convert the electrical energy back into sound energy, which is more amplified and which the patient can hear. What are the styles of hearing aids? Hearing aids come in multiple styles. These are behind the ear hearing aids, where these can be fit behind the ear and with a small tubing the receiver will be in the canal. And there are hearing aids which are like in the canal. These hearing aids will fit in the canal and they are not obviously visible, whereas these hearing aids are visible behind the ear. They can get easily damaged because of the sweating and cerumen which is produced in the ear canal. And lot of hearing aids requires batteries. These are batteries which the patient has to change every week, and if the patient is very old, it is very cumbersome to remove the battery and put the battery. So these days we are getting hearing aids with rechargeable batteries. You can see in this box there are hearing aids and you just use the hearing aid for 12 to 15 hours and then put them in the night for 3 to 4 hours for charging, just like AirPods, and in the morning you can just take bath, clean the ear and then put them again so that you can hear normally for the whole day. Selection of hearing aids dependent on the patient. If the patient wants behind the ear model, if they are okay, and if they need more powerful hearing aids, we give behind the ear model. But if the patient has mild hearing loss and they don't want the hearing aid to be seen in the public, then we prefer to give in the canal hearing aids. So once the model is selected, then we have to do the fitting of the hearing aid, which will be done by the audiologist. They usually take impressions with some silicone material, and once the impression is taken, the custom made ear molds are made and hearing aids will be given by the company as ordered by the audiologist. Once the fitting is done, then the audiologist will do the programming the device. This software is unique for each company and they program the device. Once programming is done, then the audiologist will orient the person how to use the hearing aid, how to take care of this hearing aid. These are electronic devices. The life of this device is only 2 to 3 years or maximum 5 years, depending on the company, depending on the warranty. Maximum will be up to 5 years. These are electronic devices just like our mobile phone. So you have to take care of these hearing aids, and the audiologist will teach how these hearing aids have to be used and how the care has to be taken. Once all the fitting is done and if the patient is satisfied, they will be sent home, and in the follow up if there are any necessary changes required, that will be done for the hearing aid.